Welcome to AOA's Lessons in Leadership. This is our inaugural podcast, and co-host Alex Aleem and myself are pleased to welcome our guest, Rex Haydon.
So Dr. Haydon is the Simon and Colt Families Professor of Orthopedic Surgery and Associate Director of the Molecular Oncology Laboratory at the University of Chicago. He has been an AOA member since 2009. His clinical focus is orthopedic oncology. His research focuses on identifying novel agents for the treatment of sarcomas and the use of bone morphogenetic proteins to treat musculoskeletal disorders. He serves as the Fellowship Program Director for the Musculoskeletal Oncology Program. Dr. Haydon is also serving as the Program Chair for the 2020 AOA Annual Meeting in June. We are very excited to welcome as the first guest in our podcast, AOA's Lesson in Leadership. Dr. Haydon, thank you.
Dr. Haydon, thank you so much for being here. And we invited you because we would love to hear more about the annual meeting, which is scheduled for June in Baltimore. First, can you give us any brief comments about an overview of the meeting, kind of what you see as a few highlights, then maybe we'll delve a little deeper into a couple of those areas.
Sure. So, we're very excited about the meeting. It is in Baltimore. It's at the Waterfront Marriott. It's scheduled for June 11th through the 13th. And that's just the annual meeting. Remember that there is also the associated Resident Leadership Forum, the Emerging Leaders Program, the CORD program. So there's a lot that's sort of part of the meeting above and beyond just the symposia. But I'm very excited. I know one of the questions that's probably on many people's mind is in light of the COVID-19 pandemic, what's happening with the meeting. And honestly, our intent is to certainly proceed with a meeting as close to kind of normal as possible. But, much like any of the other medical meetings that are occurring in this time frame, we're really trying to at least keep abreast of the CDC guidelines. And if there's any need to make modifications, we're absolutely prepared to do that.
Dr. Haydon, as someone like myself who really only has a limited interaction with the AOA in the first couple of years in practice, what are some of the really highlights that you think people should look for the annual meeting? Why should maybe younger orthopedic surgeons come to the AOA annual meeting and add it to their list of things to take time to?
So absolutely. I think, one of the things that we've heard from our membership time and time again during probably the past 5 to 10 years is how important this event is for leadership development and networking opportunities. And these are certainly we're dealing with many individuals who are leaders in their field. They have a lot to kind of say about critical issues, but they're also excellent mentors. And so being able to create a format for the meeting, and we worked hard to create, number one, symposia that are a little bit more interactive in their focus. So things that are going to hopefully bring people in and sort of less of somebody sitting on a podium and talking to you as much as having a group conversation, which includes everybody. And we tried to invite individuals that are participating in the Resident Leadership Forum and the Emerging Leader programs who are a little bit earlier career, to participate in those. We've also included even some networking sessions, which are meant to kind of break down some of the barriers between, I would say, younger members who may be a little kind of unwilling to kind of approach some leaders in the field, but to create a better format for networking.
Fantastic. What caught my eye were 2 guest speakers, including the Howard H. Steele lecturer, that's Bruce Gillingham, and also the presidential guest speaker, John Feinstein, who's talking about best seat in the house, a lifetime of sports. Any comments on those 2 expected speakers?
Well, I think they're very different in their focus. I'm not going to give away any details of what they're going to talk about because I think they're both very engaging and have a lot to say. One is obviously has more of a military medicine perspective. The other is sort of coaching, and these are all organizations, whether it be the military or sports organizations, where teamwork is an important part of leadership. And this is something, a broad theme that they're going to kind of come at from different angles. Above and beyond that, I'm not going to spoil with any details.
Can you speak a little bit about the Rapid Fire Symposium? I think that's a relatively new addition to the annual meeting this year.
Yeah, it's not new. Keith Cantor last year introduced this, and I think in the spirit of creating a more interactive format, as opposed to the more standard kind of symposia structures that we've used in the past, the rapid fire is meant to have very little time with somebody kind of reviewing information. We set up a problem, and they kind of throw out this issue into the audience. And basically, it's meant to be, very, very interactive with audience participation. So there's moderators, there's people in the audience that are passing around microphones. The person who's moderating is actually moving usually inside the crowd. So it's, again, more of a feeling like this is a discussion, not just a lecture. So we have, three. We noticed last year that, there's always so much time. I would say some of these topics bring up conversations. It's actually hard to kind of stop them. So we're doing three. One of them is looking at physician burnout by Lisa Latanza. One is looking at how we manage difficult colleagues, which is Julie Samora and Sandy Emery. And then we have a third one, which is looking at how we look at publications. Joe Zuckerman will lead a conversation about, whether it's quantity or quality. So these are, again, very unstructured relative to what many people are used to. And again, it's meant to really be a little bit more interactive in its content.
All of the symposiums also sound really enticing. Symposium 1 is Can We Align Conflicting Agendas, Medical Education and Value-Based Care, moderated by Daniel Murray, who I know is quite engaging. That one caught my eye. Any comments on that one or any of the others that you're excited about?
Well, I mean, we can delve into the details of each of them, but, this is a topic, honestly, that we all struggle with in not only academic medical centers, but larger clinical practices where there's still education and training occurring. And essentially, we have two competing demands upon us. One is, a value-based care system that incentivizes productivity and activities that sometimes come at the expense of education. So this is a symposium that's really meant to try to bring some leaders in the field. We also have a resident who is going to be one of the participants, and this is one of the exciting things, is bringing in voices from the resident perspective to really talk about how this is experienced by a department chair, for example, a learner, and somebody that heads a large, health group. So again, I think there's a lot. This is clearly something that we all struggle with. These are some really wonderful speakers that are going to be able to provide some real perspective on this, and I'm hoping that we'll have some really great conversation.
One of the things that I kind of found when I first started learning more about the AOA, I was fortunate to be part of the Resident Leadership Forum a few years ago. And you look at the topics, this is not what you expect out of an orthopedics meeting. And that's kind of when I first showed up at the AOA meeting 5 years ago. You don't see, there's not a discussion about fracture fixation or techniques or things like that. Can you speak a little bit? You kind of spoke at the beginning a little bit about kind of AOA's mission, but how this really should be something that orthopedic surgeons should be interested in and should participate in, because it's not something that I really thought about a lot as a resident until I came to the Resident Leadership Forum. And it's now something that I find incredibly important and impactful in my career.
Well, you bring up a really important point, and I think some of the real, I would say, the heart and soul of our organization is leadership development and also graduate medical education and the sort of education of our learners. And one of the things that we've learned is that these are not distinct areas, that actually what is critical during residency training is above and beyond simply kind of learning the specifics of how we operate and why we should operate, but also learning how to work within a team setting, how to work within a larger healthcare setting. And leadership development is something that we really want to kind of include in the curriculum at the resident and early career levels, when most people are a little bit more concerned about just learning how to pass, the OITE or the boards. And so I think the AOA has a really important role to play throughout an individual's career, because we're all, we don't practice in a vacuum. We all are kind of, touched by issues that affect the healthcare system. So this is really an opportunity to bring leaders together and people throughout the spectrum of their career to really discuss this. And I think it's one of the few meetings where it's intimate enough, where you can really get people together and have meaningful conversations.
Thank you, Dr. Haydon. That is an excellent summary. And I want to say thank you, both for your time today, but more importantly, for your time spent over the last several years putting together this meeting. It's really come together beautifully, and I'm super excited and hope it comes off without a hitch. I know we're all holding our breath a little bit.
No, we're super excited. It's probably one of the most gratifying things that I've done is kind of getting these issues together. And again, I just hope we can hear everybody's voice in June.
Thank you so much.
Thank you very much.
Thank you.